Hey guys, this is a video brought to you in association with ARC Dual Diagnosis Addiction Centers, and it forms part of a series to help you and your loved one navigate the science and psychology of addiction. A few days ago, I came across a list that has been floating around on social media of the differences between a sponsor and a therapist or psychologist, and I thought that it would be a good opportunity to explore some of the differences on that list in this week's video. I'm not going to go through all 12, but I want to explore the first 5 on the list with you guys. For those of you who don't know what a sponsor is, I'm going to give you a quick rundown. A sponsor is usually someone from a 12-step fellowship or program like Alcoholics Anonymous. So there aren't really any official prescribed characteristics that a sponsor should have, but as a good rule of thumb, when choosing a sponsor, it's probably a good idea that you choose one that's completed all of the 12 steps, and that's preferably the same sex or gender as you, that has at least 1 year of clean time, and also someone that you might relate to on a personal level. Generally speaking, the job of a sponsor is to take the sponsee through the 12 steps, but a sponsor is also someone that you can call up and meet up with and discuss your 12-step process and other challenges that you might be facing in your recovery process. Different people might have different rules for what characteristics a sponsor should have, but again, the few that I listed are a good start. So the list that I came across isn't any kind of official 12-step thing, but I think it's important to address some of the perceptions that people in 12-step communities may harbor around psychologists or therapists, so to speak. I'm not saying that the views stated on this list are held by all people in 12-step communities, but it certainly does point out to some popular ideas that are held. It also kind of speaks to the different aspects of a person's process in recovery. So let's get into it. The first statement on the list is, your sponsor isn't all that interested in the reasons you drank. If I had to guess, this statement is pointing to the idea that sponsors are focused on the solution and not the problem. It implies that their focus is less on what created the drinking or using problem and more on what you're going to do about the problem. It also implies that your psychologist or so-called therapist is interested in the reasons you drank or used, and I think this is a fair comment. It's most certainly not all that we're interested in, but part of our job is to help our patients explore the social, biological, cultural, emotional, and other triggers that might cause or simply interplay with their substance use and behavior in general. Helping our patients become aware of these triggers is challenging and intensive work, and once explored and understood, our patients should then be better prepared to make changes to the manner in which they interact with people and the world around them. So the second statement on the list is, your therapist thinks the root of your problem is a lack of self-esteem, negative self-image, and poor self-concept. Your sponsor may think your problem is the idea of self. In 12-step philosophy, which is very much aligned with the spiritual mode of being, the idea of the self is that it should be abandoned in a way so that it can make space for selflessness. Selflessness in a spiritual context is the ideal that is embodied by the 12 steps, which is aspired to by people in 12-step communities. It is a noble value, and it promotes the movement away from self-centeredness, which a life of substance use is usually marked by, towards the spiritual idea of selflessness and helping others. Self-esteem, self-image, and self-concepts are incredibly complicated ideas. In psychology, these concepts encompass the potential to cause immense suffering in the lives of our patients and their quality of life. As far as these concepts being the root of any particular patient's problems, I agree that they can most certainly create a lot of discomfort for any person where a self-concept or self-image is marked by pathology. It can also potentially cause immense discomfort for people surrounded by the person. Exploring these concepts and understanding them and the problems that they may cause can be life-changing for the individual concerned as well as for their loved ones. So number 3 on the list, your therapist wants to pamper your inner child whilst your sponsor thinks it needs to be disciplined. So this one strikes me as a point of view that isn't too widely held. I don't really have too much to say about it, except that it strikes me as inaccurate in a lot of ways from both a sponsor and a therapist point of view. Point 4 on the list is, your sponsor may think your inventory should be about you and not your parents. As mentioned, I think that this points to the spiritually motivated perspective of 12-step philosophy. The 12 steps promote taking responsibility for one's feelings and ideas. Sponsees are encouraged to own their part in resentments, to acknowledge their character shortcomings, and make amends for their part in any harm that their behavior might have caused to others. Point 4 kind of implies that psychologists or therapists aren't fans of patients taking personal responsibility, but this isn't the case by any stretch of the imagination. Personal responsibility is the cornerstone of any psychotherapeutic intervention. Motivating patients to change what is within their control is always a key part of any therapy process. A psychotherapeutic process depends on what challenges the patient is going through. As an example, on many occasions, patients might present with being very high in agreeableness. So that means that their personality includes an aspect that might limit their ability to be assertive in certain situations. A patient might have a struggle with an overbearing parent, sibling, spouse, or employer, and because of their inability to negotiate effectively on their own behalf, they might see themselves as a pushover, or they find themselves in situations that they agreed to but didn't really want in the first place. It can be very difficult for highly agreeable people to be perfectly honest with themselves and others at times. I see it very often that patients come into my office and particularly want me to help them with assertiveness training. This is different from instructing someone to be honest, in that there could be a range of factors motivating the person to avoid insisting on what they want for themselves. Sometimes this means looking at another person's role in the context of their relationship to the patient, so that we can outline how the patient can take more responsibility for what they want from that dynamic. Number 5 is a follow-on from number 4. Speaking of your parents, your sponsor may advise you not to confront them, but rather to apologize to them. If you've done some introspection and you've looked at your part and your folks are due an amend or an apology, then the onus obviously lies on you. But if, however, you've explored with a psychologist and identified that your parents may, however, be causing you to suffer in whatever way, and you want help with being more assertive around how you interact with them, then there is absolutely nothing wrong with asking for help with that. Just because you caused some trouble in the past, it doesn't mean that you shouldn't be able to stand up for what you may feel you need for yourself in a healthy and balanced way. Again, all of the specifics of any relationship dynamic are important to explore so that an appropriate strategy can be implemented. In essence then, a one-size-fits-all type of outlook on root causes or solutions to addiction would inevitably be counterproductive. Okay guys, that's a wrap of the first 5 points on the list. I hope you've taken something from this and that you can see the value around having a sponsor and how the dynamics is different in some ways from your relationship with your psychologist or therapist, which can be just as helpful. See you soon, guys.